Greetings, everybody. Thank you for joining us for this webinar. This is a informational webinar for the Robert Wood Johnson Foundation's Systems for Action Research Program and our 2021 call for proposals. So again, thank you everybody for joining us. It looks like we have a good group with us online today. So our agenda for today, hopefully if you're with us online, you can see the screen in our agenda. We'll be giving an overview of the Robert Wood Johnson Foundation Systems for Action Research Program and what it's about, what it's done so far, and then moving quickly into the specific call for proposals that has been released for the 2021 research year, describing the focus of this call and the types of research proposals we'll be looking for in this call. We'll give an overview of some of the mechanics and operations of how you can apply for this program, deadlines and key steps, and then we'll definitely have ample time for questions and answers as part of this session as well. So just some housekeeping issues. We are recording this session for those who may not be able to attend live. And so please bear that in mind. The slides for this session that we're going through today, as well as a link to the recording, will be sent to everyone who registered for this session. And we'll also post these materials to the Systems for Action website as well. At the location you see there, systemsforaction.org/funding opportunities. We do have a large group of people who are with us today, which is fantastic to see, but that does mean that we need to be careful in terms of how we manage our interactions. So we're going to keep everybody on mute during the formal part of this webinar today. And we'll ask people to use the Q&A box, which you should see a link to that at the bottom of your screen. Click on that Q&A box and you'll be able to submit your questions in writing, and we'll get through those questions as we get to the Q&A portion of today's webinar. So please take a look, make sure you can see that Q&A box at the bottom of your screen, and you can start typing in questions at any time as they occur to you. You don't need to wait until we get to the Q&A session there. There is also a chat feature, as there usually is on these Zoom interactions, and so if you are having any trouble or want to reach out to us as well, feel free to use the chat function. So just by way of introductions, we are fortunate to have leaders at the Robert Wood Johnson Foundation and leaders at the University of Colorado, where the National Program Office for the Systems for Action Research Program is located. And you can see the faces of some of these key people on this slide. My name is Glenn Mays. I should introduce myself. I am one of the University of Colorado based people in this program. I'm a professor and chair of the Department of Health Systems Management and Policy in our School of Public Health, and have the privilege of directing the National Program Office for Systems for Action. Our two leaders at the Robert Wood Johnson Foundation are Carolyn Miller, Senior Program Officer, and Octavia Wojcik, also a Program Officer, both with the Research Evaluation and Learning Division at Robert Wood Johnson Foundation. So at this stage, I will pause and see if Carolyn and Octavia would like to say a word of introduction.
Thanks, Glenn. This is Octavia. So I'll just say thank you, everyone, for taking the time to join us today to learn more about this funding opportunity. We're really excited about it. It's slightly different than some of the previous calls that we have done with Systems for Action. So please do listen to the details and please do submit questions, and I'll turn it back over to Glenn. Thanks so much.
Thank you, Octavia. The other names and faces you see on this slide are other key people involved in our National Program Office for Systems for Action, based here in Colorado. And I think all these folks are also with us on the call. Chris Lytle is our Deputy Director, who really manages the day-to-day operations of our program. Very, very important. Carrington Lott, a Program Manager, who helps with implementation of a number of our program activities, both in extramural and intramural research. Sarah Brandspiegel, who's Director of Research Engagement and Translation, who our grantees interface closely with her as they're developing findings and products from research projects and looking at ways of moving those findings into action. And then Sedina, also a key member of our team in oversees all things communications and outreach. With that, for those who may be new to Systems for Action, just a few words about this program. This is one of a number of signature national research programs launched by the Robert Wood Johnson Foundation. Initially, S4A was one of the programs that was launched in the context of the Foundation's Culture of Health Action Framework, and really charged with building evidence that can help us understand how to build a culture of health across the country. And our particular niche in Systems for Action as a research program is in studying ways of better connecting and aligning delivery and financing systems that operate in the medical care, public health, and social services sectors, so that we can actually improve health and health equity by better aligning and coordinating systems that operate across medicine, public health, and social services. So big picture, that is our mission in S4A, is in studying, rigorously testing mechanisms for aligning medical, social, and public health delivery systems in ways that improve health and health equity. We're a research program, so our primary focus really is in learning what works and what doesn't work in terms of that systems alignment work. We do have a research agenda that has guided our work over the nearly 6-year history of this program right now. So we encourage you, for those who are new to S4A, get on our website at systemsforaction.org, download our research agenda, take a look at the kind of questions we're trying to answer. You can also tour through the constellation of studies that we funded through previous rounds and previous calls for research to get a sense of the types of studies that are already underway through the Systems for Action program. So as Octavia mentioned, our 2021 call for proposals was released a few weeks ago. And it's a little bit different in terms of focus, a little bit more a narrow, more specific focus as compared to the calls for proposals that we've released in previous years of S4A. So definitely important to take a close read of the 2021 call for proposals. In particular, this call for proposals, we are focusing on a specific problem that's very common among efforts that are launched to try to better align medical, social, and public health services and systems, and that is this wrong pocket problem that is described in the call, and that I know many colleagues who work in the space of multi-sector systems alignment commonly face. The wrong pocket problem, in a nutshell, arises when you have organizations that are attempting to work together to implement a collective action solution that would help to align medical, social, and public health services. But the problem is those organizations that operate, that work in those different sectors have very different allocations of resources and power and influence. And partly because of that reason, the costs of implementing a collaborative solution that involves those organizations fall disproportionately on certain subsets of organizations in that collaborative. But the benefits from that can accrue from that collaborative action or collaborative action work, those benefits accrue to different groups of organizations in that collaborative. And so what we have is the costs of the collaboration are distributed differently across different organizations from the benefits of that collaboration. And so what happens in that circumstances is there are typically just insufficient incentives to invest rigorously in the collaborative solution. And what you get is collaborations that either don't get off the ground or that remain at very low levels of investment that never are able to be scaled up and sustained, because the people who bear the costs are different, and the organizations are different from the organizations that really benefit from the collaboration. So we're looking in this call to test solutions to that wrong pocket problem, specifically in the context of aligning medical, social, and public health services. Again, we encourage all of you to, again, take a read of the full 10-page call for proposals, where we describe this problem, this wrong pocket problem, in a little more detail. We give some examples of specific areas and specific types of collaborations that often face these kinds of wrong pocket problems. So specifically, what kinds of research proposals are we looking for to try to tackle wrong pocket problems? Well, again, S4A is a research program we're looking for proposals for research studies that will study an innovative potential solution to a specific wrong pocket problem that faces medical, social, and public health systems and organizations that are working in those areas. And so the research proposal should propose to evaluate the impact of this promising solution to the wrong pocket problem, looking at specific outcomes that are relevant to that solution: health outcomes, economic outcomes, social outcomes. And as a research program, we are looking for proposals that use rigorous scientific methods and designs that are designed to estimate the impact, the causal effects of the solution on outcomes of interest. In particular, and also that is, as we describe in the CFP, we're especially interested in solutions and evaluating solutions to the wrong pocket problem through an explicit racial equity and racial justice lens. So we're really interested in understanding the impact of solutions to wrong pocket problems that in particular can help to eliminate racial inequities in health and other economic and social outcomes of interest. The fourth point on here also very important. We're looking for proposals for research studies that can really evaluate the extent to which the proposed solution succeeds or fails in eliminating the wrong pocket problem by more equitably distributing power, influence, resources across those collaborating organizations and systems. And so that's a key point here. In terms of the research design, we want studies designed to really evaluate the extent to which the solution actually works in reducing or eliminating the wrong pocket problem. It's fundamentally a problem of inequitable distribution of power and resources across collaborating organizations. To do that, to succeed in that, successful proposals also will need to propose a research team that has the relevant theoretical, methodological, and practical expertise that is needed to study the wrong pocket problem of interest, to study the proposed solution, and to carry out the proposed scientific research design. The sixth point on here, we are a for-action research program. That last word in our title, action, is a deliberate word that describes the type of research we're trying to fund. We're funding research that can produce findings that can quickly be moved into action, and findings that can be useful to stakeholders within communities who are seeking to implement, sustain, and scale up these kinds of solutions to wrong pocket problems. So that means it's important for research proposals to include authentic community engagement methods as part of the study, to engage stakeholders, the kinds of end users who are going to use the results from the study to implement solutions, and engage those kind of stakeholders in the research process itself. And then finally, it's important that applicants to this CFP build into their project specific intentional research translation activities that are designed to take the findings from the study and get them into the hands of relevant stakeholders, community stakeholders, who can, again, use those findings to scale and spread solutions to wrong pocket problems in their communities. So 7 key elements on this slide that we're looking for proposals to include in their proposed approach. Some other additional information about likely characteristics of successful proposals to this particular call. Again, proposals need to be testing a specific solution that will align delivery systems and/or financing systems that cut across those 3 broad domains or sectors of social services, medical care, and public health. Historically, in our past call for research proposals in the Systems for Action program, we've actually required that all 3 of those sectors be involved in the system alignment potential solution that's being tested. And we're continuing to give strong preference to studies that engage all 3 of those sectors in the proposed solution. Again, sectors being medical care, public health, and social services. We have decided in this CFP to allow for some degree of relaxation in that requirement, and that now we are requiring that at a minimum, the proposal should engage at least 2 of those 3 sectors. They must engage social services, and they must engage at least one of the other 2 sectors of medical care and public health. But again, we're definitely going to give preference to proposals that engage all 3 of those sectors in the proposed solution to the wrong pocket problem. So take a look at that requirement as well. Again, the 10-page CFP gives you the definitions that we use in S4A for those 3 sectors. What do we mean by medical care? What do we mean by the social services sector? What do we mean by the public health sector? Those are key, very important definitions to consider. And again, very important that proposals engage at least 2 of those 3 sectors, ideally all 3 of those sectors, in the proposed solution to the wrong pocket problem. Our definitions of those 3 sectors, again, are listed out in the CFP on page 3 and 4. Please definitely take a look at that. We do use pretty broad and inclusive definition of what we mean by the medical care sector, the social services sector, and the public health sector, but definitely take a look at our definition there. Again, this is a research program. We are attempting to produce scientific, broadly generalizable evidence about solutions that work to the wrong pocket problem. And so we're looking for studies that will use rigorous scientific research design that can support inferences about the impact of the solution on health and health equity outcomes of interest. So strong research design, critical here. And then finally, again, to remember, we're interested in studying these solutions from a systems level perspective. We're looking at studies that can examine system level change, the impact of the solution in terms of generating systems level change on the distribution of power, influence, and resources across collaborating organizations. The crux of solving the wrong pocket problem is more equitably distributing those costs and benefits across collaborating organizations and sectors. Okay. So nuts and bolts of this CFP, again, we are anticipating being able to fund up to 4 proposals for up to 4 new studies that will be funded under this call. Each of those successful proposals will receive up to $500,000 in total funding from the Robert Wood Johnson Foundation to support the proposed research. And each of those applicants will have up to 36 months, 3 years to implement their research and then conduct their research, translation, and dissemination activities with that funding. So awards of up to $500,000 in total costs for up to 3 years, 36 months in duration to carry out the research and the translation and dissemination activities. The last point on this slide, again, is also important. This is a research program, so the funds, we're anticipating applicants will use the funds primarily to support the research activities around studying the impact of the solution to the system alignment problem of interest there, rather than using funds to primarily support implementation of the solution. So that's an important thing to recognize. As a research program, we're looking to fund primarily research studies around helping us learn about the impact of potential solutions to system alignment problems. So if you are primarily looking for sources of funding to implement, an innovative initiative, as opposed to funding to study the impact of your innovative solution, then this call may not be the best, place to look for funding. If you're looking for funding to support research, this is the place for you. If you're looking for funding to support implementation of a novel idea you have, there are probably better sources of funding for that. And again, we're glad at the staff at our National Coordinating Center for S4A, glad to answer questions or help you determine whether your idea really fits within a research call for proposals, or whether it might fit, might be a better fit for a kind of a non-research type of funding opportunity. Okay, on this slide, I've given you a few links to key resources that I think if you're considering putting together a proposal for this call, these are resources you definitely want to spend some time reviewing and understanding, because they can really inform your approach and your application. The first link is just a link to the landing page at the Robert Wood Johnson Foundation that has the funding announcement. The second link here, very important, is a link to the actual 10-page call for proposals document. There's a larger, a more in-depth document that describes this opportunity in detail that you want to make sure you can review and get through all 10 pages. So don't just go with the information on the CFP landing page. Make sure you download the 10-page PDF document that is the full description of this funding opportunity. Third, we also have a document that has frequently asked questions about the S4A research program and about this particular call for proposals as well. The link to those frequently asked questions is on the Systems for Action website. That's the third link that you see here. The fourth link is a link to our research agenda in S4A. I mentioned that earlier. Again, a good background, especially for applicants who may be new to the S4A program. And then finally, also on the Systems for Action website, you can access descriptions of previously funded S4A research projects if you again want to get a general sense of the types of studies that have already been funded through the S4A program. So encourage folks to take a look at all 5 of these resources as you're crafting your proposals. Okay, just another, just not to put too much of a fine point on it, but this is a screenshot of what that landing page on the RWJF website, the landing page to the CFP opportunity looks like. This landing page gives you a general description of the funding opportunity, but the full 10-page funding announcement is available. If you look at that, where that red arrow is, it's kind of buried down on the list a little bit. On the right-hand side, you'll see a link to the full funding opportunity. You want to make sure you click on that and download that CFP as well, because that's going to have much more detailed information about what we're looking for, our definitions of sectors, our definitions and examples of wrong pocket problems, a full explanation of the review and selection criteria that we'll be using to select proposals, and then specific details on what information you want to make sure to include in your proposal, all listed in that 10-page CFP document. Okay, so eligibility criteria for this particular CFP. This has not really changed. This has been consistent throughout the lifespan of the Systems for Action program, and is also pretty consistent with other research funding opportunities made available by the Robert Johnson Foundation. Applicants who can be the lead applicants to submit proposals for under this CFP need to be public entities or nonprofit organizations that are tax exempt under 501c3 of the IRS code. If you've got a question about whether your organization is eligible to be a lead applicant, feel free to contact us and we can help answer questions on that. But in general, you need to be a government agency or a tax exempt nonprofit organization. You also need to be based, your organization, the lead applicant needs to be based in the US or one of its territories. It's absolutely appropriate and even encouraged for applicants to develop multi-organizational consortia to respond to the CFP. You may need to have multiple collaborating organizations, but you will need to choose one of those organizations, a single organization, to be the primary applicant or lead applicant. Okay, application process. So we are asking, it's not required, but we are asking those of you who are anticipating submitting an application to the CFP to please submit a brief one-page letter of intent to us by April 30th. This is not required. You do not have to submit an LOI. You can just submit your main application, but it really will help us if you will submit a letter of intent by April 30th. This gives us a heads up about how many applications we can expect. It also gives a heads up about the general nature of your application, so we can make sure to recruit reviewers who have expertise that is relevant to your application. So it's really to your advantage to, if you can, to submit a letter of intent to us by April 30th. So that we can make sure we've got the right expertise represented on our external review committee to really be able to understand and appreciate your proposal. It's not binding. You're not held to any information that you give us in the letter of intent, but it just helps us design a review process that will give your application every consideration. So that's the first thing we ask. LOI by April 30th, just a brief letter that you can submit through the link that you see here. This link is also provided on that CFP document, as well as on our website, systemsforaction.org. The full proposal will be due by June 9th at 3 p.m. And you must submit that full proposal, that application, using the Robert Johnson Foundation online system. The link to that system is included in the CFP. It's included on that landing page. There's a big green button that says, click here to apply. That takes you into the portal to submit your application materials. Again, those application materials, full proposal due by June 9 at 3 p.m. Eastern Time. Please do not wait to the last minute to submit your application materials. You can upload materials as you go throughout the process. When we get to these deadline periods, there tends to be a lot of traffic being directed through the RWJF website. It's always the possibility that technical difficulties could be incurred either on your end or on the RWJF website end. And so to avoid bottlenecks and constraints, I encourage you start submitting your application materials and uploading them, well in advance of that deadline if you can. The other thing is, as we get closer to 3 p.m. Eastern on June 9th, we can't guarantee that we've got staff available to be able to respond to emergency questions that you might have about the logistics around submission. So start early and plan for getting in your application materials as early as you can. You got several months. We've built in a long lead time for this CFP response, and that's by design. We know that it can take time to build the right collaborations, to construct the right interdisciplinary research team, to design a strong study and think about methods and data sources. So you've got some time. You've got several months to kind of work through and refine your process. Applications that are received by that deadline will go through a rigorous research review process, guided by our leaders at the Robert Wood Johnson Foundation and by members of a national advisory committee that serve the S4A program. We also have a larger constellation of external reviewers that we recruit to review the applications, score the applications, and make funding recommendations. Final funding decisions, as always, are made by the Robert Wood Johnson Foundation. And we anticipate being able to notify successful applicants about funding decisions by the end of August of this year, 2021. Okay, just a reminder of some key dates. April 30th is when we're asking for the one-page letters of intent to be submitted to us via our Qualtrics link. Again, not required, not binding, but strongly recommended, because it will help to make sure that your application, we've got the right reviewers in place to review those applications. Deadline for full proposals, June 9th, 3 p.m. Eastern time. Remember, Eastern time, and again, try to get your materials submitted in advance of that deadline. Don't wait till the last minute. By the end of August, we'll be making funding notifications about the funding decisions, and we anticipate these grants will be starting on or about October 15th of 2021. And again, they will run for up to 3 years. Okay, so that's the overview of this CFP, and we are now at the Q&A portion of our webinar today. And so we've got a number of questions already submitted in the Q&A box. I'm going to just start running down this list. And so first question, are you to propose a solution and then evaluate it? Or should applicants be evaluating an existing solution? That's a good question. I would say either of those situations could be relevant here. You may have an existing solution that's already being implemented, and you're going to study that solution to really find out whether and to what extent it works. That would be one legitimate scenario. However, other scenarios are possible. You may have a new solution that's currently not being implemented, and you're proposing that solution be implemented, and you're going to put the research design around that solution and study its impact. That's another possibility. I would offer some words of caution about applicants who are proposing to study a solution that's not currently being implemented. Is that typically for those kind of proposals, our reviewers look closely at issues of feasibility and likelihood of successful implementation. And so I would say if that's your case, if you're proposing to study a solution it's not currently being implemented, you really want to make the case, strongly make the case in your proposal that there's a clear feasibility of implementing the strategy, that there's not going to be uncertainty about whether the solution can actually be implemented. You want to provide information and reassurance that really will assure reviewers that what you're proposing is definitely feasible for implementation, and therefore feasible for rigorous study and evaluation through the proposal. It's a little bit of an easier case to make, the case of feasibility, if you're studying something that's already out there being implemented in the real world. But both of those scenarios are plausible in terms of applicants to our program. Question about the equity lens. Will we use an equity lens when evaluating proposals? Wrong pockets issues have at their core inequity. And it's often harder for Black and brown researchers to have access to research grants like this. Absolutely, we could not agree more with that statement, Cheryl. And yes, absolutely, we will be evaluating proposals through an explicit equity lens, including explicitly racial equity. You can see that evidenced in the actual review criteria that we'll be using. One of those 7 review criteria speaks directly to the equity lens, and we absolutely will be using that lens in evaluating proposals. We work carefully to make sure we've got expertise in racial equity and other equity issues on our National Advisory Committee and in the larger panel of external reviewers that will be reviewing these applications. Okay, and definitely invite any of my other colleagues from the program, Chris, Carrington, Sadina, Sarah, feel free to jump in and help me answer these questions as well. But I'll just keep going down the list. So how many proposals do we expect to receive? You know, we always have a large cloud of uncertainty around this issue. You know, I would, you know, in our past CFPs, we've received anywhere from 60 to 140 proposals in response to past CFPs. And so it's definitely, you know, a competitive process. You know, we historically have seen a lot of interest in these applications. So, you know, I think you can anticipate it will be competitive. I would encourage you as applicants to not shy away from this opportunity based on the potential for a large volume of proposals being submitted. One reason that we often see there are, you know, large numbers of proposals that we receive that really that don't meet all the selection criteria that we're looking for. There are often applicants who submit applications that don't carefully read our CFP and really understand what we're looking for. And so that cuts down the competition quite a bit. And so I would say, if you read our CFP, if you feel like your idea is a good fit for what we're looking for, you know, then we encourage you to submit your application. Don't shy away based on concerns about, you know, high levels of competition or maybe low likelihood of success based on a large volume of applications. If you've got a good idea, we want to see it, and if your idea, you know, fits within the parameters of the CFP, it will likely fare, you know, it's got a strong potential for faring well in our review process. Okay, can you please provide specific examples of wrong pocket problem and breadth and width of the expectation by RWF? What I would suggest is for these examples, for you to pull down that 10-page full call for proposals. We have a bulleted list of 4 or 5 specific examples, spelled out specific examples, even listing specific programs and referencing those, again, as illustrative examples of wrong pocket problems and the need for solutions to them. And I would say that they're very, very common in the context of multi-sector collaborative solutions where you're trying to get organizations from medical, social, and public health sectors to collaborate in implementing a solution that that can address an issue of health and health equity. So everything from trying to get healthcare institutions like hospitals to collaborate in expanding access to quality, affordable housing, recognizing that housing instability is a major social determinant of health that can cause can be a major driver of health inequities for populations that experience housing instability. When you do that, those solutions, if they're successful in addressing housing instability and therefore improving health by improving access to housing, those solutions have the potential to disproportionately benefit medical care organizations working in the medical care sector, for reducing readmissions in hospitals, or reducing avoidable medical care expenses for health insurers and public programs. That's a kind of a classic wrong pocket problem where implementing housing interventions, the costs are largely borne in the social services sector, but the economic benefits from that initiative may accrue disproportionately to organizations in the medical care sector, to hospitals, to health insurers, to Medicaid programs, et cetera. So classic example of a wrong pocket problem. How do you solve that? That's what we're looking for, solutions that can solve that problem. Other examples are spelled out in that CFP. They're illustrative, they're not exhaustive examples, but I encourage you to read through those, and you may even want to click on the references to some of those examples to get a sense of a better sense of those issues. Okay, moving down the list. A question, am I understanding this accessible proposal must include the actual redistribution of power, influence, and resources to address the wrong pocket? Good question. Yeah, that's what we're looking for, at least studies that can test whether the solution actually does help to redistribute those sources of power, influence, or resources, because those inequities in in the initial distributions of those resources are a big part of what drives the wrong pocket problem. So we're certainly interested in studies that can evaluate the extent to which that redistribution occurs as a result of the solution. I mean, the solution you're testing, it may or may not be successful in redistributing those sources of power, but we definitely want studies to be designed so that they can examine the extent to which that happens. And again, we're after scientific knowledge, and so learning about failures, solutions that didn't work, is just as important as learning about successes, solutions that did work to address that. But we do want proposals that are designed to look at that distribution and redistribution as one of the core elements of their study design. Okay, good question. Julia asked, is there going to be additional funding opportunities for the action or the implementation phase after the research? That's a great question. Something that we are always actively discussing with the Robert Wood Johnson Foundation, our National Advisory Committee, is what is strategies that are needed once we have findings about solutions that work or don't work. Making sure that we've got the resources and the infrastructure to get those findings into the hands of stakeholders, community stakeholders who can act on those findings. So at this stage, I can't speak to things that may be to future opportunities that may be available to support the scale and spread of successful solutions that are tested through the CFP. But I will say that is a core piece of the larger Systems for Action program mission, and we work closely with RWJF, with our National Advisory Committee, and others in designing those kind of scale and spread initiatives. So, but definitely, in terms of what applicants need to be thinking about, we do want you as applicants to be thinking about what's possible to undertake in the context of your research proposal in terms of dissemination and translation of research findings? Great question. Okay. Can you define what you mean by community engagements? Good question. I think in general, and we're open, we're open to many different ideas that you may want to propose around community engagement. When we use that term, we're talking about engagement of stakeholders who are likely to be in a position to use the evidence that you're going to produce through your research study. You should have in mind who could actually act, who could use this evidence. If we find out that this solution works or this solution doesn't work and why, who's going to be in a position to use that evidence? Those are the stakeholders that we encourage you to think about engaging in your research project. Because if you want those people to use the evidence, one thing that we do know is that engaging those people on the front end in the research project will make those stakeholders, put those stakeholders in a better position to be able to use the findings once they come out of your study. So that's really fundamentally how we think about community engagement. There's many different strategies that can be used, many different stakeholders that you as the applicant, you really need to figure out who are the relevant stakeholders here, who are the knowledge users, who's going to be able to use the scientific knowledge that we produce through the study, and then thinking through how you best engage those kinds of people and institutions in your research project. So certainly equitable evaluation principles, as you mentioned, would be clearly relevant. Okay, will anyone be evaluating letter of intent? Yeah, we're not really going to be able to evaluate letters of intent, and certainly not going to be able to provide feedback on letters of intent. We're using letters of intent purely as an information signal to us, to the program, both to gauge the likely volume of applications we're likely to get, and that tells us how many reviewers we need to pull together, but also to gauge the range of topics that we're likely to see so that we can make sure to have the right kinds of reviewers at the table as part of our review process. So that's the only way that we're using the LOI. We're not going to evaluate them for merit or fit. We're not going to be able to provide feedback, based on the LOI that you submit. And we recognize it's non-binding. So what you tell us in your LOI, that may change, dramatically by the time you actually submit your proposal, and that's perfectly fine. It's an early warning signal to us about volume and topics that will help us put together the best possible external review panel. Okay, the most important question, the most important industry impacts may be well beyond the time frame of the proposal. Yeah. Absolutely. This is a problem in studying system alignment activities. And particularly, strategies that are solutions that are addressing, underlying, determinants, and that are really trying to address upstream determinants. These solutions you're testing, the real effects, especially on ultimate outcomes, health and health equity, may need significant time to accrue. So how do you deal with that in the context of a 36-month research proposal? One, encourage you to be explicit about the long-term outcomes you expect to occur as a result of the solution. But for the purposes of your study, you need to hone in on more proximate measures of outcomes, that things that are likely to change that you can measure in the context of a 36 month project. So for feasibility, you're going to have to focus on more proximate measures of outcomes. So that's one strategy. A second strategy that some studies may want to use, and we highlight this in terms of the types of designs and methods that may be relevant here. is it that some studies will use simulation techniques as a way to project the possible long run effects of the solution. So that's another potential method that may be applicable to some types of studies here. So that could be another strategy. And a third strategy I might put out there would be retrospective studies. There may be, for certain kinds of solutions, you may be able to use existing data to study retrospectively over longer periods of time how that solution has played out. And that's only going to be relevant to certain types of studies that are studying solutions that have been implemented over time and that can make use of retrospective longitudinal types of study designs. So those are three ideas. Focusing on proximal measures of outcomes, using simulation to simulate, future long-term effects, or using retrospective data to look at longitudinal retrospective changes over time. A few ideas. Those aren't exhaustive. You may have other ideas. We're looking for, for any other ideas you have on that front. Okay, moving right through. Question from Melanie: is there a preference for regional or national approaches, or are all opportunities equally regarded? Yeah, I would say we really are agnostic as opposed to the type of setting or settings that you're studying. Specific local level interventions can produce very instructive and important evidence, but also initiatives that are implemented on a larger geographic scale, in multiple communities or at a regional or even national level studies that are capitalizing on geographic variation in, exposure to some type of solution. All of those are fair game. All of those kinds of studies, can produce instructive, valuable scientific evidence about, multi-sector solutions to wrong pocket problems. So, really leave that up to you. What's the opportunity that you see for studying a promising solution? Is it in a single community or a single neighborhood, but one that may have, may generalize to other settings? Or do you have the opportunity for comparative multi-community kinds of research, regional or state level or national studies? All of that is really fair game. And the second piece of that, any preference for higher education institutions or another type of institution, I'm assuming as the lead grantee? Absolutely not. In fact, we think that many different types of organizations may be in a good position to lead these types of studies. Academic and research institutions are one type of institution that historically commonly serves as the lead agency for a research grant, but because of the collaborative and action-oriented nature of the research we're trying to sponsor here, non-academic institutions, government agencies, community-based organizations may be equally or even better positioned to serve as the lead grantee for this type of a grant. I would just reiterate that this is a research grant, and so for non-research organizations that are serving as the lead grantee, most likely you're going to want to have a partnership with another organization that can bring the research expertise into the project. But in terms of which organization serves as the lead applicant, does not need to be a university, an academic, or a research institute. It can be a government agency. It can be a community-based nonprofit, professional association, any of those. Whatever arrangement really provides the best support for the research project that you're proposing. Okay, moving right through. I know we've got maybe 4 minutes left. I'll get through we'll get through as many of these questions as we can, and then any that we don't get to, we will, and when we send out the materials, we'll post written responses to these questions as well. Thinking about the wrong pocket problem, the emphasis is either to shift funding away from the healthcare system, or shift to human services or other social determinants of health. That may be true, but as you mentioned in your question, it's not always the case. In some cases, the resources may be disproportionately lodged in another sector. As we're, for example, looking at interventions that involve law enforcement and criminal justice, and looking at collaborative solutions to support justice-involved populations. We may be looking at reallocating resources away from a social services sector, law enforcement or criminal justice into other sectors. And so, so medical care organizations tend to be better resourced than some of the other sectors and some of these kinds of collaborations. And that may be the focus, rebalancing resources from medical care to other sectors, but not necessarily, just depending on the nature of the problem and the solution that you'd want to test. Okay. Briefly explain the distinction between our S4A opportunity and the E4A opportunity. So E4A is a sister research program of the Robert Wood Johnson Foundation, Evidence for Action. We do have an FAQ that describes that distinction. In a nutshell, what I'd say, for Systems for Action, we focus squarely on delivery and financing systems and testing solutions for better aligning and coordinating delivery and financing systems across medical care, public health, and social services. E4A has a broader focus, not necessarily a narrower focus on system level alignment and integration. So that's one important distinction. But feel free to also read our FAQs for more information about that. There are other for action programs, policies for action, data for action, and then these are all sister programs to our Systems for Action research program. We do share some similarities, but we also have our own niches of research. And again, for S4A, our niche is studying system alignment across delivery and financing, system alignment across the medical, social, and public health sectors. Okay, I know we're down to our final couple of minutes. Let me see if I can get another question or two answers. I'm going to, are we looking to find wrong pocket problems from different arenas, such as selecting different problems to address? Absolutely. We are, again, agnostic in terms of which specific sectors you're looking to align and to solve wrong pocket problems in. We're looking to you as the applicant to describe, to make the case for the constellation of sectors that are implicated in your solution, why it's important to solve the wrong pocket problem that that is of specific interest to you and your collaborators. So we are open, again, to studies that involve a whole range of different sectors that cut across medical care, public health, and social services. And I'll get to one more question. Question about, it sounds like applicants need to have existing funding sources identified and secured. Is that true? And I would say certainly if you're proposing a solution to a wrong pocket problem, to study that solution, it needs to be able to be implemented. And so certainly, we'll want to look in your proposal for evidence that the solution you're proposing to study is feasible for implementation. If there's funding that's needed to support implementation, then that needs to be part of the case, that you make, that those funding sources, exist to support implementation. We have an FAQ that's also targeted at this same question as well. If you're looking for this one grant to support both implementation of the solution and a rigorous research to study the impact of the solution, that's asking a lot of a single 36-month $500,000 research grant to support both implementation and impact. So just encourage you to think carefully about that. Those kind of proposals, we often have concerns about sustainability. If the only source of funding for the solution is this one 36-month research grant, what's going to happen at the end of 36 months? How could the work be sustained if you find it to be successful? So just encourage you to think through carefully those kinds of issues and determining whether your idea is really right for a research funding opportunity such as this one, or whether you really need to think through securing funding for an implementation grant first from another source before you look to put a research design around it. Good question, and we're glad to talk more about that if you want to contact us. So we haven't gotten to all questions. We will post written answers to the remainder of these questions and send those out to folks who are registered for this webinar. Thank you all for joining us. It's been a quick hour. Feel free to email us if you have other questions. You can find our contact information in the CFP document, also on the slides for this call, which we'll be sending out to everyone along with the recording. Thank you all so much. We look forward to getting your applications and your great ideas. Please stay safe and be well. So long, everybody.